Alrighty, welcome guys to our Wednesday edition of our Sales Dojo here. Today we're doing a little, I would say it's like Q&A, but I just want to go over just some common Medicare questions we have, stuff about what we do here, things that we say, things that we do, why do I need this information, whatever's going on with some of our newer people here. Congratulations to the winner side of this table here. No offense here. It just so happened you act like I didn't do this on purpose here. Okay. This side of the table today made their first sale. So, way to go.
Congratulations.
Okay, Kristen, why don't you tell us just a little bit about yourself? How it happened.
About how it happened?
Yeah.
Yeah, so I actually called her this morning and she didn't answer. She sent me to voicemail. So left her a very nice voicemail and she called back a few hours later and got back on the phone with her. And she was already covered by a Plan G, but she was wanting a cheaper price for it because all she had for her income was Social Security. So with the help of Jacob, we were able to get her down to $130 a month instead of $170. And she loved it. She loved us, and she was all for it. She was excited.
And we got to do her drug plan here in like a week.
Yeah, we'll do her drug plan in a week also.
So that'd be 2 sales for her. Going through. So proud of you. Way to go. I had to flirt my way a little bit through that one. That was one of the best lines I ever had.
It was hilarious.
Talking about her name. But okay, go ahead. Mike, what about you? How was yours?
It's simple. 4 hours.
Oh, just 4 hours.
Just 4 hours.
That's the easy thing. Yeah, ours is like an hour and a half.
Yeah.
Can you believe people try and do this in 15 minutes?
No.
Yeah.
No.
Yeah.
They're lying to you.
I mean, people do it in 15 minutes, but do you think it's good?
No.
Probably not.
They
No.
don't get all the information across.
So actually, tell that story because it's a very interesting story. Because you weren't in here yesterday, were you?
No, I was
So
out.
okay, tell that story.
This gentleman, I started calling in 9/20 of last month. Left 4 voicemails. He called in yesterday. He was now ready to talk to me. So when I got on the phone with him, he was really unenthused. I'm calling you back. I know this is a waste of my time. He was very, very just sad about it. This guy lives in Maryland. He lives in Rock Hall. Rock Hall is a peninsula into the bay. So they've been getting bad weather for the last couple of days, raining, windy, so this guy had nothing but time now to sit and call. So we talk about what happened. He went down to the senior center because he needed help. And they signed him up on some bare bones plan with a prescription card. The prescription portion cost $30 and the policy was $270.
Ooh.
Okay. We're like, okay, tell me about it. Well, I go to my pain management. We got a list of meds. I wanted to know, what did you do for a living? I'm a maintenance man. Well, what'd you maintain? Apartment complex. And I said, how many units was that? He says, 125 units. I said, sir, you're busy. Did you ever have anything get hurt on you? Are you in aches and pains? He goes, oh, had my right knee redone. I had a rotator cuff done 2 years ago. The knee was done 5 years ago. He says, I'm done. I had retired at 62. I said, and he has bad back. We had some common ground, knee, rotator cuff, stuff like that. But we had to slow everything down to establish that common ground, show some empathy because of the fact of he felt like nobody was there to help him. And the other part of that, he's in a rural area.
Mm-hmm.
So he's still got to go to the doctor is 2 hours.
Yeah.
2 hours to go see the doctor.
That's
so
crazy.
he's like, I don't want to screw that up. I want to stay with the same people. So I said, you know what, let's see what we can do. Come to fixing up all the information. And how I retrieve that information is my building blocks of staying with the script. asking those questions, keep going, keep going. We go off track, circle back, get back on the path. That was the biggest thing that I've learned here. Your building blocks, these fundamentals, you have to execute your fundamentals to stay with the conversation because, we could be at the end of it, both of us in tears about how life treated us and, and all the wrongs that been done. And, we're going to make it right one day, the whole 9 yards. But we need to come back. So, long story short, we get all this information to him. We find out we can't disclose anything. We don't have a scope of employment. We don't have a permission slip. No email. His cell phone is a flip phone. He doesn't receive text. So I said, okay. So by then, Victoria's helping me. Is there anybody in the house that can help you? No, but my sister has a cell phone and she can receive text. Great. We set an appointment for the next morning because by the time we got done, it's 4:00 there, it's 5:00. 4 here, 5 there, the whole 9 yards. It's wet, raining, it's heavy rain. I set an appointment for 9:15. The guy was calling me before 9. My sister's here. I'm ready to go. And I'm like, well, let me see what I got. Slow it down. But I said, you know what? I think, I said, I can tell you this with all the confidence. I'm fixing to change your life. And he got really happy about that because nobody's taking the time to talk to him. So he ends up getting a plan, no premium, stay within all his doctors. Also, it's going to pay for his medication. He's also going to get some money for food and over-the-counter stuff. So this guy's hooked up like a tow truck. He's got it all now. Super happy with us. Victoria finished it up and helped me sign this person up. But I will tell you, I stopped at the very end. I said, I need a couple of things from you before you get off the phone. He says, what? I said, one, write my phone number down. You got my name. You got Victoria's name, right? Yep. Okay. If you got an issue, you're going to call me, right? I'm your guy now, right? Yep. I'm your agent, right? Yep. I said, the other thing is, tell everybody you know that you need to call me at the senior center, and I'm going to help you. You promise? Promise. I said, so, hey, I'm going to check up on you here in a few months. Holler at me if you need anything. See you later.
Awesome.
That's awesome.
That was awesome.
So one thing that I think is funny between your two stories is Mike kind of went through everything. I kind of had to jump in a little bit. But if you notice through his story and when I hop back on, what did I immediately go back to?
The script.
I immediately went to, okay, let me just verify this information. Okay, so your name is blah, blah, blah. This is your zip code. Okay, are you living here? Okay. And then what I did after that, she was like, well, who are you guys? And I said, well, let me tell you about it. So I went back through the who we are. Then I went to the discovery portion where I was like, okay, so right now you're paying like $170. She's like, yeah, I think I'm also getting an increase here. I was like, okay, we'll figure it out. All right, what else do you have? Then got into medications, then went into prepared statement, and then said, okay, now we're going to take a look. Like once you do it a lot, it gets ingrained in your brain that you just can't get rid of it. Like I've done this so much that I can do that without thinking about it. And every time it just somehow comes back to the foundation like Mike was talking about. To where I can hop on and you're 15 minutes in and I still go, nah, I'm still at page 1. We're not at 15 minutes in yet. We're still at page 1 here. Let me verify some stuff before we get going and hop on. So it's one, just like Mike was saying, it's terrific. You just got to build your foundation. Just the more reps that you can get doing that, the more that you can rely on it in the future. Because if you saw, I had my script pulled up, doing it for 3 years, I can recite that backwards and forwards, but I still have my crutch of having it up because I kind of wanted to show you, so you could follow along with me. So great job, you guys. Okay.
Thank you.
Now we'll get y'all later this afternoon because it's like Little Caesars in there. All right, they hot and ready.
Right.
Okay, it's a hot and ready kind of day. So, what I wanted to do here after we talk about the success stories and everything, I kind of just wanted to do just a general Q&A here, where some of the newer agents, if you have questions about Medicare, about processes. Justice, I know you had a question. You were talking to me at my desk. It'll come in a minute. But,
Yeah, I was like, I've had a lot of questions today.
but I just wanted to open it up to you guys and hear from you. You know, is there something Medicare related topic? So talking about coverage, plans, whatever it is that you have a question about right now. That
Yes.
you might need some clarity.
What is the difference between a supplement plan and an advantage plan?
Okay. You want the
I want the simplified version. Wait until I get my license and then we'll
Okay.
talk more about it.
Okay. So here's your basic definition.
Okay.
Let's do this. On your sheet of paper, I want you to draw a line down the middle. Oh, funny how this works, right? On the left,
Here we go.
on the left, I want you to write supplemental. And on the right, I want you to write advantage. So you're on Medicare right now. You're on Medicare Part A and B. You're turning 65. You want to sign up for a plan. You know you can get either one of these here. Okay.
Mhm.
Here's the difference. Under supplemental, I want you to write any doctor. That phrase exactly. Okay. Then go under advantage plan. I want you to write network of doctors. Okay. Go back under supplemental. We're just going to work left to right here. I want you to write $226. And then under advantage, I want you to write 800-13,000.
That's a big jump.
And last one here, I want you to write another dollar amount, say 100-200. So we're talking about somebody at 65 here. And then on the other side, write advantage plan 0 to about, I'd say 100. Okay. So this is your simple breakdown. This is also why you guys were asking. You're like, do you have them written down like when we're going through A and B? Absolutely.
Okay.
Because for a lot of people are visual learners.
Okay.
And this is stuff too where I have people, once I do this presentation, they hold on to it.
Okay.
And if we have to do the spouse that's in 2 or 3 years, I'll ask them, I was like, hey, do you still have that sheet?
Mm-hmm.
They go, oh yeah, we still have it. I go, perfect. Okay. I'll have people, I'll sell the husband and then the wife will turn 65 in 3 months. And I'm like, hey, do you want me to go through that presentation again? And they're like, absolutely not. And I get offended and I'm like, why? And they're like, save me the hour and a half. And I was like, but I've really been working on like the theatrics of it. Like I added in a new like twist and turn. There's a new paragraph. Like, come on.
You sure you don't want to do
Exactly. I was like, it's invigorating. But this is your simple breakdown. Okay. So let's start with supplemental on the left. This is what those mean here. Okay. You can go see any doctor that takes Medicare. So it's about 96%, when we looked it up a few weeks ago, about 96% of doctors across the country take Medicare. Okay. That means that if you are here in Texas, if you are in Oklahoma, if you are in New York, if you are in Alaska, if you need medical attention and there is a doctor or hospital that is available that takes Medicare, they take your insurance. Okay. Now, below that, $226. That is the deductible for next year. That's starting 2023. So that amount is the most amount that you would have to pay out of pocket per your health care. So that's your deductible for the year.
Oh, per year.
Per year. Now, below that, that is your monthly premium. That is how much you have to pay. Okay, that's just a rough estimate for 65 here. Okay, it's about 100. I mean, you come in Texas and it's about $89 without a household discount for a female turning 65, Harris County.
Okay.
Type situation. So it's just a rough. But you go to Florida, that might be 225, 250.
Okay.
It's just very dependent upon state and zip code. So that is it just for bare bones what a supplement is.
General.
Okay.
Advantage plan now. You notice the word any is not in there anymore.
Mm-hmm.
It is network. So now with an advantage plan, you are agreeing to a private contract with a private company to use their services. So what that means, if we talk to somebody like Christopher ran into, somebody that has a WellCare plan, WellCare is the company, okay? You can have a few different types, HMO, PPO. At the end of the day, don't worry about the HMO, PPO right now. Just worry about it. If you have a WellCare plan, the least amount you're going to pay for your health coverage is if you go to a WellCare facility or a WellCare doctor.
Okay.
That's the easy point to it.
Okay.
So you are now, instead of going and seeing anybody that takes Medicare, you are giving that a stiff arm. And you're saying, nope, I want to work specifically with one company in their network of doctors and their network of hospitals.
Okay.
Now, in exchange for that, you're out of pocket. So how much you could owe for the year. These are the maximum ranges here.
The
Maximum minimum.
deductible.
Lowest I've seen in California for one plan was $899. Highest I've ever seen was in Florida for $13,000. The amount that you're going to owe, if everything hits the fan here, okay? Because you're paying by services.
Mhm.
You're paying for services rendered, right? So as you go, you're going to have to start paying more. That's the maximum that you have to pay out of pocket, okay?
Nice.
Now,
The $100?
no, the 800
Oh, the 800 to the 13.
13,000.
Okay.
Yeah, that's how much your care. So you know how we have the deductible on the left? That's Advantage Plan deductible.
Okay. Deductible.
Or deductible out of pocket, same thing for this instance here. Okay. That's the maximum amount of money you would have to pay for your health care in a year.
Okay.
Now, next one here, majority of Advantage plans that you run into are $0 premium, but there are some that can cost up to $100.
Okay.
So you might
So-
not have to have a monthly premium. You might be $0 premium, or you could be $30, $40, $70, somewhere in that range there. So when you break it down, really comparing the two to each other, you have option A, which is a supplement, which is in exchange for a higher monthly premium, you have virtually no out-of-pocket and no network restrictions, versus an Advantage plan to where you don't really want to have to pay out-of-pocket for it. And in return for you not paying as much monthly premium, you have to pay more as you use it, and you're now restricted as to who you can go see.
Okay.
That's the skinny of it, real quick.
All right.
I could have gone the long version. But you
No,
said
no, that was
That's
cool.
okay.
I think I understand it now.
So
that
most
works.
commonly, if you want to put underneath there, you will find underneath the Advantage plans, just put this in parentheses, HMO dash PPO.
And that's what you were telling me to ask the lady earlier or yesterday when I was on the phone with her.
Mm-hmm. So that will tell you what type of Advantage plan they have. Those are the two, without getting into much detail, those are the two ones. HMO, you can only go see, let's use WellCare for example, you can only go see WellCare doctors. If you go to see somebody and they go, I don't take WellCare, you got to pay out of pocket. You have no insurance.
Okay.
PPO, you can go see doctors that say, I don't take WellCare. You go, okay, but I'm going to have to pay much higher for it than somebody that is in network with WellCare. Okay. That's the skinny of it. So a lot of people, Advantage plan is very similar because it's just like employer or group coverage.
Okay.
It really is. You pay a monthly, you might pay a monthly premium for it. You know, you got a deductible of $8,000. I got a plan with Blue Cross right now. My deductible is like $7,000. I think I pay like $100 a month for it. I haven't been to the doctor in 4 years. Just not a big doctor guy. But I have it just in case something does happen. Now I know I'm going to have to pay a buttload if something does, $7,000 straight out of pocket, but I'm accepting of that risk. Now, if I could get a plan G myself here at 29, I'd be going to the doctor every day. Okay, I would have every ailment known to man because I only got to pay $200.
Yeah.
If y'all want a serious story, this is what I tell people here. You heard me say this on the phone when the lady was talking about how she has IBS. So this is about a year ago or so. I came down with a bacterial infection here at work called C. diff.
Mm-hmm.
So has anybody here ever worked in healthcare or housing? Okay.
And I caught it too
And,
last year.
and you've caught it as well
Yeah.
too. So it wasn't for me though. It wasn't me.
Are you sure, Jacob?
There's your Shaggy reference there for the day. I'm a musical artist. But
Oh my God.
so wasn't me. So I didn't know I had C. diff, right?
Uh-huh.
I never get sick. Like I pride myself on never getting sick. I pride myself
Lucky
on
you.
never showing up late or leaving early. It's just something I do. I just want to work. I don't know. Maybe I just want to get out of my house. I just really want to work. Okay. So I came in here and I was like, God, I just do not feel good whatsoever. I was like, stomach just hurts. And I was like, okay. So I had like a banana for breakfast, went straight to the bathroom. I was like, okay, this is kind of hurting here. Then like 30 minutes later, had a cup of coffee, right back to the bathroom. I'm like, all right, something's up here. Had water around like 9:15, straight to the bathroom. And I was like, okay, something's not right. By 10 o'clock, I tried to drink water again, same result. And I go, I got to go home. I go, I can't keep anything in me whatsoever. Like it's just nothing is staying. I'm severely dehydrated. I got to go home. Okay. So I go home and I love the house cold. I like it when we sleep. It's not cold, but it is cold, like 70 degrees or so. Okay. So our house was already at like 72 at 10 o'clock. I put on like a hoodie, jacket, 2 pairs of pants, get under the blanket, get under the duvet, get under the blanket, get under the heated blanket. I'm just like out. Okay. I'd sleep for about an hour. I go take a sip of water. Same thing. Go straight to the bathroom. This happens until 5 o'clock. And I literally have no energy left. Like I'm just done for. Like I can't move. Michelle had to go pick our dog up from Liberty Hill because he was at doggy daycare. And when she was coming back, and I just go, you got to take me to the emergency room. I have no fluid in me. I have no food in me. I have nothing in me. I weighed myself. I lost from 10 o'clock until 5 p.m. at least 7 pounds.
Mm-hmm.
Oh my gosh.
I know. I was hot. I was hot for like a whole minute. But
Feeling like something's wrong with you. Yeah.
But so then I had to text Michelle when she was going to pick the dog up, which it's like 15 minutes to Liberty Hill, about 20, 30 minutes back with traffic. And I go, when you come back, I want you to take me to the emergency room. And that's when she goes, oh, okay, something's really going on here if he's doing that. She goes, okay, let me grab the dog. I'm going to run into Walgreens and CVS, go change. And when you get back, I'll take you to the emergency room and we'll go. I said, okay, perfect. So I change, I lay back down. I got every fan blowing on me, still can't drink water, can't do nothing. And she comes in and she's like, look, I got 2 things for you here. Here's a Pedialyte. See if you can sip on this and drink it and not have to go to the bathroom. I was like, okay. So I sipped on it, gave it like 5 minutes. She was like, all right, you can drink that. Good. Next is what she did. She slid me. It was like real G moment too. She slid me my Blue Cross card. She goes, I grabbed this at your wallet. I want you to flip it over and take a look at where it says ER. And I go, okay. Grab the card, flip it, $1,000 copay. And I go, I think I'm feeling a little better. Okay. Like it's stupid, right? It's stupid. And then I killed off like 2 bottles of Pedialyte because I didn't know you can't drink water in a situation like that. Like if you drink water, it's going to go straight through you or it's going to come back up. You have to drink something that has like substance to it. So I killed like 2 bottles of Pedialyte and it was fine. I went to like the gastroenterologist the next day and he was like, yeah, man, it looks like you got C. diff. Do you know where you got it from? And I'm like, no, I have no idea. Maybe from eating tacos. I had this new green salsa that I was really into at the moment. I was like, maybe it's that. But that's a serious story, not only because that relates to people with their advantage plans with everything going on. Mm-hmm. You know, I saw that amount of money just to put my name on the list. And in my head, I go, this ain't worth $1,000, me going right now. You know, I might go to urgent care tomorrow and pay, $45 copay and then see what happens. This ain't worth.
See what they give me. That's what
exactly.
That was me. I most definitely went to a small little hospital and they gave me some fluids and told me that I need to take some medicine. That's all I paid for was the prescription. That was it. Mm-hmm. So.
And that's right. Then you got your antibacterials and that take for 2 weeks and then all good. And then it was funny because like a month later, I got it again.
Really?
Yeah.
So do you know if that's something that's common? Because like I caught it, but then like 2 years ago, my sister caught it.
I don't think it's that prevalent. I think there's certain things that I guess that just don't get like cleaned off. Because, they say you commonly get it in hospital or like home
They
areas.
told us we probably got it from the daycare because at the time both of us were working at a daycare center.
I think it was something like that. So somebody was touching some bathroom stalls here or something. But just wash your hands, people.
Yeah.
Okay. But that's or just go rope. Just start
It's a
licking doorknobs.
bacterial.
So, but
What?
do what? Oh, I said just wash your hands. Just make sure you wash your hands here.
I mean, it's not
But-
it's not contagious or anything.
C. diff. Okay, it's like a something. I don't know. Nico, don't bother looking it up.
Well, I was gonna.
It's like
I was
something
Googling it.
bowel syndrome or
It's a
something.
very
like that.
very long Latin name for a bacterial infection. But the point of that story was, not only is that something you and me can bond over, absolutely, right? It's something me and the lady on the phone bonded over
Yeah.
because she had her own story about it.
Okay.
But
really?
the insurance thing comes to it as well. When
Yeah.
we talk about Advantage plans, that's a story I like to use. Here's a quick one. Okay, I was so proud of Michelle at work yesterday. So she's leaving her state job, right? And she was like right at the point to where she would be, what's the word when you work there for like 10 years?
Retired.
Tenured.
Oh, 10.
She was like a few years from her tenure. Now she's going over to the private sector and whatnot. But she was talking to somebody. And
You
she's
make
like,
more money.
man, this guy was like, that's dumb because at least get your tenure because then you get your, when you retire, you get your retirement benefits and everything like that, and they'll pay for your health care. And then she goes, have you ever looked at that plan? And I was like, baby, I'm so proud of you right now. Keep going. But she was like, have you ever looked at that plan? And I go, and the guy was like, well, no, I just know it's good. I just know it's a really good plan. And she goes, okay, let me go through it with you here. All right. So the state's going to pay for your premium. Terrific. Okay. So it's $0. You're still going to owe Medicare $170. Your out-of-pocket's probably going to be about $8,000 for the year. Would you rather have it be $8,000 or $230? And the guy was like, well, like $230. She was like, okay. And would you rather have a plan where you can go see any doctor or one that's very limited because not a lot of people take the state Blue Cross plan? And the guy was like, what are you talking about? How do you know this? And she was like, I've got Jacob. Jacob tells me all this stuff.
She's like, I got my husband.
She's like, I got a guy. I got a hookup.
Got a guy.
But that was the funny thing was she's doing what we're doing there where you can get people so brainwashed with Advantage plans or coming off of group coverage and say, I'm just going to start my retirement coverage. And they think that, man, this is terrific. This is awesome. This is the best thing ever. But they just don't know. Like that guy was 55 that she was talking to. And he thought he had the rest of his life set up, that he was going to have the best insurance from state pension, have all the retirement so he could retire at 60, have that plan. Then when he turns 65, get on Medicare. They put him on another plan. He never had to worry about anything ever. And then reality hit him like a brick from a 5'5", 120-pound brunette lady in her 30s. Okay. So that's
Where does she
something.
work?
She worked for the state health department.
Okay.
State of Texas. But that's
What department?
health department. Off camera. Okay, so does that kind of answer Advantage plan,
Yes,
supplemental plan
it
situation?
does.
Okay, perfect.
It does.
All right. Anybody else with any kind of Medicare benefit?
Yeah, I was
Go
gonna
ahead.
say, so what you were pointing out with that story is that the plan that would be issued by the state would be more or less analogous to an Advantage.
It
plan.
is an Advantage plan.
Okay.
Mhm.
Yeah, just wanted to make that clear for myself and everyone else.
So a lot of, and you guys will run into this too, if you work a lot of T65s as well. If you hear somebody that's like, I've got teacher's retirement, a lot of time what that means is that, if you have your tenure, if you've worked there long enough where they'll help you with your health care. Once you get on Medicare, they'll say, we'll put you on a plan, but guess what that plan is? That plan's an Advantage plan.
Advantage.
Now, here's the theory behind it. I want to ask you guys here. First one they answer gets a cookie, okay? Why do you think employers and retirement groups want to put their employees on Advantage plans? Once
So they can make more money.
And it's less out of their pocket.
Because
They want to make
they're
money.
$0.
Yeah.
They don't have to pay for any bit of their health care. They can get them signed up. They can look like a hero and say, you know what, you're going to have this awesome plan. Here it is. It's not going to cost you anything. Well, that's because the employer is not paying anything either.
Yep.
Mm-hmm.
Now you will run into some, it's few and far between, but there are some employers where they'll give you like a $400 benefit a month where you can do it. And in that case, you can absolutely get a supplement. It's just a little bit hectic with the payments of it because the company's got to pay for it rather than the person. But you don't run into it too often, but it is out there. So that's the main reason why. And it takes you a while for it to kind of sit in. I mean, you guys are learning at a quick pace here with it, but you want to find the reason why behind a lot of these things. So like, why would an employer want an Advantage plan over a supplemental plan? They go, well, because
All the money.
they don't have to pay any monthly premium. I mean, if you were 75 and you just retired and say you're in Florida, okay? And if I'm the employer and say, I want to help you get coverage, what's going to look better to me? Me paying $0 as an employer for your retirement where you're not even making me money anymore. I'm just doing this out of the kindness of my heart versus me paying $375 a month for you. Employer's going to pick zero every time.
Every time.
Every time. Go ahead, Mike.
Question a lady we had yesterday, Florida, said she was not on Medicaid. She was having her prescriptions paid by Florida, the state. She had something different. I wanted some clarification on that. You remember?
Was that the lady we talked to? I don't think it was. Was it the lady? That was another lady we talked to.
Mm.
No, because the lady we talked to, we did the scope for. She was out for it.
Yeah. We're going to be doing that.
So the clarity on that is one key thing where I can say more than likely you're probably on Medicaid because there's different levels to it. Okay, so just so you guys know, there comes a point where they do have what they call low income subsidy. Okay, and I think the lady even asked about Medicaid too when
She
you and
did.
me were on the phone. She's like, "What's Medicaid?" And I was like, but so what she was talking about is there's usually a threshold for you that you have to hit income wise before the state that you're in and the federal government will start assisting you. Okay, it kind of starts at $1,800 or so and works its way down. So if you make under $1,800, but say you make more than $1,500, what you might qualify for is what they start off with, low income subsidy. So what that means is you're not quite on Medicaid levels just yet with your income, but you do make under this certain percentage, certain amount that we set. So the closer you get to the Medicaid level, the more that the federal government will help you with your prescriptions. So in this case here, she might have been, there's 50% LIS, there's 75% LIS, there's 100% LIS.
It's LIS.
Low income subsidy.
Gotcha. All right, so a couple of particulars there. The lady was in her late 70s, early 80s, still working, healthy as a horse. Remember, she was only taking Tylenol as needed.
Mhm.
Yeah, but she gets some of her prescriptions. That's what threw me off because I'm healthy, yet I get my prescriptions. That's why I was like, I'm not on Medicaid.
Mm.
And then you talked to her, she's on Medicaid.
Or was she on the low income subsidy?
So she was actually on Medicaid because I went over the financial limits with her, and she was actually on Medicaid. So to kind of continue here, that's the start of assistance when we talk about are you getting any help? Okay,
Right.
so it starts off at the prescription level. Okay, so you can get 50, 75, 100%, but that is a federal program that is helping you.
So does that money go through the state though? So they think they're getting
Federal.
it from the state?
Federal.
That's what threw me off.
So
Okay, so a lot of people don't know exactly what's going on. So she told you that it was coming from the state, right?
correct.
But
Back up
it was
a sec.
actually
Hang
coming
on,
from
back
the
up a sec.
federal government.
She said she did not have Medicaid.
Mhm.
Period.
Right.
From until he broke that down, and then all of a sudden I get Medicaid, and then it wasn't. It was at a federal level.
Right. So my point, like being that a lot of people don't actually understand what their situation is.
People don't
So
know
if
what
you
the
get
hell
their-
they have.
Right. So you tell
Welcome
them
to seniors.
get their card out
Uh-huh.
and then read to me what's on that card. That's how you figure out
But
what
hang-
would-
Hold on, guys. Hold on. Reading that card will not tell me if you have Medicaid.
There you go.
It won't. It won't tell me if you get assistance. I have to listen and ask certain questions to find out if you do. So let me work my way down the line here, guys. So we're just talking about federal help here for prescriptions. With LIS, low income, they set certain limits for prescription costs. The highest that you can get assistance with, meaning the highest you're going to have to pay for a prescription, is about $9. Okay. So if somebody has let's say Eliquis, they're on Eliquis, which is a blood thinner that's about $600 a month.
Mm-hmm.
If I'm going through their med list and they have Eliquis here and they're not complaining about paying for it, I'm going to ask them, hey, by the way, how much does your most expensive medication cost? Like, I'm just trying to get an idea for you. And they're like, that's like less than $10. I'm like, you could help.
Mm-hmm.
Because there is no way in heck there's a plan out there that is covering a $600 drug without any type of financial assistance for
Okay.
$10.
So when you say federal, you just mean like the government is
The
helping.
United States government is helping. Yes,
pay
correct.
for their. Okay.
So it starts with prescriptions. Now, the next level it goes to, and there's a handful of different levels within Medicaid. But Medicaid is a state-run program, okay, that is based upon income limits. So it can start anywhere $1,500, $1,400, $1,300 a year, okay?
Clarification. So that pertains to Florida.
Correct. This is when Florida, your example, would kick
Yeah.
in, okay? So
So you
So
can't
they're all
just take.
different in every state.
There you
correct.
pieces.
Medicaid works in every state. Now, with Medicaid, another question I like to ask to figure out somebody, I forgot who I was talking with. I had somebody on the phone. But there was a guy I think it might have been yesterday, where he was talking about how he was like, yeah, I had this surgery and that surgery. And he's like, yeah, I'm pretty healthy and everything. And he goes, but yeah, my plan, it didn't cost me anything. Or he was talking about his surgeries and everything he had. And I was like, did you have to pay out a lot for that? And he was like, oh, no, I barely had to pay anything for it. I go, So you had like rotator cuff surgery. You had your knee replaced. I think he had cataract surgery too, all within like two or 3 months or so. And then I just asked him, I was like, how much did you have to pay for that? And he goes, well, I didn't pay anything. He goes, I got good insurance. And I go,
That's not insurance.
I don't know if you do know. But was able to talk to him. So turns out he was on Medicaid for the state that he was in. That's why he wasn't having to pay anything. Because the skinny of it all is, if you're on Medicaid and you qualify under a certain level of income per month, the state will help you with your medical bills. They will help you with your Medicare premium. They will help you pay money going out. So that can go anywhere from starting out at SLMB up to FBD, which is full benefits, which means you're on Medicare and Medicaid. You don't pay a Medicare premium. You don't pay when you go to the doctor. You don't pay for a prescription.
I wish.
You don't. But they're also under like $900 a month in income.
Okay. So if you're
Okay, go ahead, Alice.
I had a scenario this morning with a lady who has Part B and she's on Medicaid.
Mhm.
So based on what the knowledge that I got from Stephen and Victoria, they said that she can apply for through her Medicaid to get Part A paid for.
Ask me these questions, okay? So
I was like, okay,
all right.
so how is
That's
that
it.
gonna work?
That's it
Okay,
for
one more footnote.
Okay.
She only has 6 credits towards her SSI.
Exactly. So, okay, next thing here. So that's it for low income and Medicaid. That's how they work. Now, before we get off of Medicaid, because I'm going to answer your question here with a different thing. Medicaid is only good in the state that you live in. So if I have Medicaid through the state of Texas and I have to go to Oklahoma for it, I don't have that assistance anymore. So that's why when we work with people who are on Medicaid, we like to get them into an Advantage plan. Because number one, they do make plans that are specific for people that are in that situation. They're called special needs plans for when you're on Medicaid and Medicare. But we like to get them Advantage plans because number one, they can't get a supplemental because they don't have the money for it. They can't afford a premium, and it's illegal to sell a supplement plan to somebody who's on Medicaid. It's illegal. Okay, but as well, if you do have to go out of your state, you do have some type of health coverage that travels with you, because you go from, even if you're making, we'll say the bare minimum $800 a month, okay, and you're on state Medicaid, you're paying $0 for a lot of the things that you do medically because you qualify with that income level. That's fine and dandy for Texas, but the minute you cross over the Louisiana border and you have to go see a specialist, you no longer have Medicaid. So you got to have something behind it to give you some coverage. So, 2, talk about your lady here
Okay.
or person. It's a little, without seeing everything in front of me, I'm just going to make an assumption call here. Okay. So she works 6 credits. Is she disabled?
We didn't get to that part. She's gonna
Okay.
call me back. She's gonna call
Disability is the first question I would ask. Now, how old is she?
67.
Okay. More than likely, she is probably not going to get Medicare Part A for the rest of her life.
Really?
So, just so you guys know, in order to get a supplemental plan, in order to get an advantage plan, you do have to have Part A and Part B. You can't have one or the other. You got to be full-blown Medicare in order to get a plan like that. So in this case here, this individual, where I've run into this before too with people who they might just not have worked, or they might not have paid taxes. Or I've talked to some people who live in trailers in Colorado that have never seen a cell phone. They just have one landline and that's it. And they haven't paid taxes in 30, 40 years. Okay. You have to work your credits to get Part A. You have to, or you have to pay for it. So this year it was like $500 until you get to 30, and then it was like $270 until you get to 30 to 40 for credits. And credits are, you guys know, it's the amount of time that you work and they collect Medicare from your paycheck. Roughly, it's about 10 years. So as long as you work for about 10 years and you have taxes taken out, Medicare taken out, you don't have to pay for Part A. Part A is free.
Oh, cool.
In this case here, what tells me is it was one of you two. We had somebody like this yesterday. That only had Part B. They didn't have Part A. Or was it
No,
this
that
morning?
was me. That was
Yeah,
this
I
morning.
had
So-
somebody
that
that
was-
was on Part A and B, but he wants to go to Part G
Plan G.
Plan
or Plan G. Yeah.
That's okay. So that's somebody else we can do too. But in this case here, so for this person here, normally, if you are disabled, okay, and you can't work, now this is up to the state as well too, but you're on disability for more than 2 years, you do have a right to go on Medicare fully, A and B. And then the state will help you out. Now, some states will do it automatically. So if you're like 50 years old and you're on disability for more than 2 years, the state wants to put you on Medicare. Do you know why?
Cheaper?
Because that's a federal program. It's not a state program.
Mm,
So when you're on state disability, see, again, this goes back to the why.
right.
So this is why I like doing these, so you guys can know kind of behind the scenes why things happen. So say you've been on disability for 2 years and it's here in Texas, okay? That means that Texas Disability has been paying for you. You hit a 2-year mark, they can finally go, you know what? I'm tired of paying for this person. Ship them off to the federal government. Federal government comes in with Medicare. Now, all of a sudden, they go from paying 100% of you with Texas Disability down to 20.
So it takes over more than half of it most of the time.
Correct, because
So
Medicare still, once you get on Medicare, they're still covering your 80%. So again, it's a way, I mean, that's just how the world is. Everybody's trying to cut corners. Everybody's trying to pay less. But the weird thing about it is some states might not do it. They might not do it automatically after 2 years. You might have to do it yourself. And it's really sad because what I found with a lot of people that are in that situation, they hate doing paperwork. And I go, you just have no idea how much more help you would get just applying for Medicare and getting it. Because look, you're probably going to be on Medicaid as well too, and they're going to pay for your premiums. You're going to have everything paid for. Medicare's going to pay their 80, Medicaid's going to pay the remaining 20. You're set. But so many people don't want to do paperwork. Blows my mind. That's another topic. But okay, circle the wagons
So
here.
that
Back to this. Hold on. Circle the wagons here. Back to this. So in this case here, she probably was either disabled or she never worked. Okay. Never worked is a real tough one, because if you never worked and they never took money out, then you were going to have to pay a premium in order to get Part A out. and you already have to take your Part B out. She's already paying for her Part B as well too. Now, she was on disability, different story. She might have had a chance to take Part A, but she never did. So it's not necessarily, it is something where she would need to call Social Security and figure that out, because everybody's different when it comes to it. Everybody's got different levels of credits. Everybody gets different qualifying. But from what I can tell from that here, if we're over age 65 and we don't have Part A, then that tells me that you are not able to work. And that was either by choice or by disability. That's what I have to find out. Because if it's disability, we might have something in play here. If it's by choice, I don't care what it is, you got to break your checkbook out. Nobody's helping you out here in this situation.
So you said most of the time, if they don't have one or the other, one of the two parts, it's because they either have a disability or they can't work. Or didn't work.
That's just Part A.
Yeah.
Oh, for just Part A. Okay.
So Part B is being paid by,
So she's
Medicaid?
paying for
Oh, she's
Part
paying for
B.
it. oh, she's paying for Part B.
Uh-huh.
Okay.
Because so you know how we talked about, I think it was last week or so, people where you can be on work coverage and you're continuing work coverage, but you're getting on Medicare. You can apply for Part A and not get Part B until you say, you know what, I'm done with this coverage. I want Medicare coverage by now. So you're still getting assistance if you get in the hospital. Medicare is still going to pay 80% of that hospital bill. The remaining 20 is going to be billed to your insurance. So it's just kind of the opposite for her. That's where if she does have current insurance, if she goes to the doctor or anything like that, that doctor's visit is Medicare is going to pay 80%, and then her insurance is going to pick up the remaining 20, or that's how it's going to be billed. Versus if she goes to the hospital and she only has Part B, she gets hospitalized. There's no Medicare there to help her with that portion of it.
She's gonna be out of pocket.
Or her insurance that she has now. Yeah. Okay. Christopher, I think you were next. You had a question.
Yeah, well, I was just wondering about an email template, because you said like if somebody's been called like 3 or 4 times or something, is there an email template that you send out, or do you compose it yourself?
We can do that.
The
I can
email
show you that
template that Jacob has is just the first line of our script that we
Justice, why don't you read him the email off the top of your head here?
This is Jacob. What's your last name?
Karate.
At Medicaid Gurus.
Medicare Gurus.
Medicare Gurus. I don't remember exactly what it says.
Here's my email. Here's my email. Ready, Christopher? I'll use it like I was calling you. Hey, Christopher, it's Jacob Karate here with Medicare Gurus. I tried to reach you at your phone number because I got a request for help with Medicare.
Yeah.
Period. So what's going on? Enter dash Jacob. Send.
Okay. All right. Well,
He was messing with me earlier with that.
Policy is or whatever, because if there are
It's okay.
email templates, then
I would
that's
rather
fine.
have you
If not-
ask. It's okay. That's what. And then I showed her too, and I go, we send out text messages too, right? When we call somebody, and she goes, really? Show me. And I go, guess what the text message is?
Yeah.
Hey, this is Jacob Crotty with Medicare Gurus. I got your request for help. What's going on?
Call me back.
Let me say something.
Oh,
real
wait,
quick about-
Christopher.
Oh,
I
go ahead.
was just saying that other organizations will have like, this is the email template for that, this is the email template for this, blah, 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 so on and so forth. So
You're Picasso. You can craft whatever you want. If you want to write a 7-paragraph template, you can.
no,
I don't know if anybody will read it.
I don't know what it is.
I'm getting the lay of the land.
It's okay. All right, Mike, go ahead.
2 things. One, when you send out a text like that, and when you space it out, a lot of people are, if these folks are still driving, if they have text, voice text that reads off, that's why you want to keep it simple like that. Because if they're in the car and they play your text, it'll read it off.
Yeah, I wasn't talking about
That's
text. I was
text.
talking about an email.
Let me finish. I'm giving you some information.
Yeah.
So hang on. The other.
Okay, well, I wasn't
Stop.
talking
Hang on.
about
No.
the
Stop.
text. I was talking about an email. So-
Roger that. I heard that and understood it. But what I'm trying to get to is there's a reason for it. And then the email, you want to do the same thing. You want to keep it simple, because if you're too long, they're going to blow through it, because some folks will read it, or they'll read the subject line and move on. So you want to keep it short and sweet.
That's fine. I wasn't proposing to send some long email. I was asking exactly what it is what the company does. That's what I want to know.
That's good.
Is what Jacob wants.
So
to
I'm
know.
actually kind of glad you brought that up, because we had this conversation before with the two youngins here, as Mike would say. Who here checks their voicemail? Raise your hand if you do. Okay. Now here's the new age of it. Who here reads their voicemails? Okay. If you get a voicemail
I get a text
and you have to
message.
go and scroll
You're not
to read it,
And I've personally
Some
had
are too
people send emails and I was gonna read it, but then after
It
I see
was
that
too
they have like
long.
a whole, like I'm
You're
like,
like,
I'm
you
not
moved
reading this
on.
right
It looks
now.
like a
And then half of the time I forget to read it. So
you know what? You know what I love is there's a thing on Twitter where I forgot what it was, but it was just a picture, but somebody who had like this really long text message and they're like scrolling through it, and it was like, man, either I'm really proud for you or that sucked, but I ain't reading it. like that's the answer to it there. To where if it is too long, there's just you're not going to have the
Nobody's gonna
attention.
read it.
Nobody's going to have the attention. That's why you always want to mix it up. You always want to try it a little bit too. But it took me years of trying things in order to come up. And it may sound dumb with how simple it is, but really, if you just approach it, just so what's going on? There's no agenda. There's really
Do it your
not.
own way.
well, some people might still think you have an agenda.
It's
because
cool.
my guy earlier, he was not
They
happy
can-
with me.
They can think that. That's okay. And
He
those
wasn't.
you got to be careful with, because some people that was like, well, you can't help me anyway. That lights a fire underneath me, and I'm like, you don't understand. I'm obsessed with you now. I have to help you. Like, there's one. Has anybody here watched New Girl?
Yes.
Yeah.
It was a show. Like Nick has a really good quote on it when he's. I think I used it for.
Him and
He's,
these quotes.
he's talking with who he thinks is Cece's mom, and she's just yelling at him and yelling at him and yelling at him. And he goes, "You better stop, or I'm gonna fall in love with you." Okay, I've said that on the phone for people that are pissed.
Really?
Yes, because I'm just trying to help you. Like,
yeah.
get it through. Like, I'm not trying to sell you anything. Even like the lady that we talked to today, she was like, "So what do you do?" And I'm like, "Well, what do you need me to do?"
Whatever
And she
you
was
need me
taken
to.
off guard by it. What? And
Well,
go,
I wish you were there when I was talking to my
It's
guy, 'cause
okay.
he thought I was trying to steal
I
his
was
information.
helping her. It's okay. It's
Yeah, he wouldn't give me his information off of his card. I told him I didn't need the number, but he was like, no. He was like, that is a government issue document, and I'm not giving you any information off
and
of
I'm
there.
like,
I was like,
you're like, I
whoa.
don't need it.
I
Like,
was
we
like, I
ain't
just
doing
wanted to know
nothing.
what plan you were on. That was it.
Yeah. You have something, Mike?
Yeah, it's the what's going on, really and truly. Take it off the table. You're trying to sell me something. No, I'm not.
I tried
No.
that. He
Just
just
stop.
wasn't very
Because of
happy.
the call that I had yesterday, ladies, how can you help me? She's upset. She's cussing. She's from Georgia. She's got an eviction notice. Her daughter that passed away, she's lost that death benefit, $780 out of her check. She can't pay rent. The granddaughter, that's the daughter's kid, is in high school, just turned 18, so she lost the benefit for that. This lady is backed up against the wall and has no coverage, and she's freaking out. But you
Yeah.
got to let them.
Rant.
Yeah, you got to.
Oh, yeah, of course.
And pull them back in.
Yeah.
Well, hey, are you another insurance salesman? No. You know, and that's how we got a conversation. Are we going to visit her in 2 weeks? Yeah, we got an opportunity, but we got to let her calm down, put out her fires. But yeah, it was a dumpster fire at the very beginning, extremely volatile, you know, so I had to bring in Victoria right away. Just give me the path and we'll get there. But yeah, it's just what's going on.
And it took years of trying that. And I think this is my pro tip for today. Okay, this is what we'll at 12:55. That's what we'll take it out on. So, one theory and one kind of mindset that I changed that really led to a lot of me creating relationships on the phone and not only closing deals, but also helping out a lot of people, is the mindset of, I don't want to have to sell you something.
Mm-hmm.
If they ask if it's a sales call, I do not lie. I say, I am a licensed agent, but I don't want to have to help you. And people, when you say it out loud, people go like, what the heck? Like, what?
You're like, what are you even talking about?
Like, what do you mean? And I go, I don't want to have to sell you something.
Mm.
I don't want to have to, because then that means that you have everything good.
Yeah.
Like I even told with Kristen, with our lady, where just from the very beginning, and I was like, look, you say you have a plan that's $150. That's actually your 170, 175. I was like, that actually sounds pretty even to me. That sounds pretty okay. Now, I don't know if that's good or not yet, because I'm not at that point, but
Right.
I tell you, that sounds pretty good for that. Now, is there psychological stuff behind that? Yes, there is.
Yeah.
But in your own head, when you don't have this, I got to sell something. I got to sell something. Everybody that picks up, I got to sell something. If you just tweak that a little bit, just try it to where in your head you're like, I don't want to have to help you. Because then that means that you have everything taken care of. That means that you have addressed every single need that you have. You have a response for every bad thing that could ever possibly happen. I don't want to have to sell you anything. If you do need help, it's my job to find out how I can help you. Because that little tweak takes it from being, like Stephen had a term for it, he called it commission breath. When people haven't sold anything in a while and they're just desperate, they're just trying to sell, sound salesy and everything like that. If you just take the sales aspect out of it and go back down to the root of it, it is, I don't want to have to help you. But if I do, I'm here for you. So that's our tip for the day. Anybody, we get 2 minutes left. Any quick hit Medicare questions? Anything left? Okay, I'm sure we'll have some more here. So that is it for today. For our dojo. Thank you guys for joining for this little Q&A session. Appreciate it. Be on the lookout here. Seniors, we do have our Part D video coming out with this beautiful face here. Very, very soon. That is going to get Grammy nominations and Emmys. I don't know Emmys. Whatever it is. Spotify, top hits,
He's
top
like, I
category.
don't even know. Is that a thing?
It's going to get rewards. So that'll be coming out soon. So if you do have questions about prescriptions, whatever it is, give us a shout. Thank you guys again for watching. And if you're an agent, go sell something. Have a good day, guys.
Bye.